Okay, so we are recording. So welcome to our webinar on pre and post-op endo excision surgery for like nutrition and rehab focused. So Katie and I are going to introduce ourselves. So I am Sabrina. I am a pelvic floor therapist. I am an integrative women's health coach, and I am soon to be a birth doula, which is really exciting. And I work with people with endometriosis, honestly, every single day. A lot of surgeons recently have been sending them to me for more pre-op intervention, which has been amazing. And then post-op, I will work with them as soon as 2 weeks post-op, which is really great too. We're going to talk about that as well. And Katie here is just a plethora of information. I'm so excited for her to introduce herself. So Katie, go ahead.
Yeah, I'm Katie Edmonds. Sabrina, I could have used someone like you during my pregnancy and then before my surgeries as well. So I wish you were in my life earlier. But I am a nutritional therapist. I specialize in helping women with endometriosis. I have 2 books. My more recent one is Heal Endo, an anti-inflammatory approach to healing from endometriosis. And I have a pretty extensive blog, healendo.com.
Yes, she really does. And her book's amazing. So I feel like I'm always plugging your book. I love your book.
Oh, thank you. I appreciate that.
All right, so we're going to discuss nutrition, pre-op, post-op, supplements, pre-op, movement, rehab, some self-care strategies, and we're going to save some time for Q&A. We're going to try to keep this around the hour mark because Katie has to get her kids. So if we are running a little bit behind, around 11:45 Katie's time, 5:45 Eastern time, we'll stop for Q&A, and then I'll finish up the presentation. All right, Katie, you take this away because you wrote this one. You go for it.
Yeah, I threw this slide in there last minute. I think these conversations are really important because for many of us, we've kind of been told that these surgeries are like simple, a piece of cake. I was told that for my first surgery, my gynecologist, he delivers babies and does pap smears and was going to do my surgery. He's like, oh, my last client, a patient, she ended up playing tennis the day after her surgery. It's not a big deal. I'm not making a big incision. I just go in through your belly button. And I think that set myself up for failure in a way. I was thinking, okay, it's super simple. I'm just gonna, well, I don't play tennis, but I'll do whatever I want after. I'll just be so much better. And even though that was like 15 years ago, I think, videos like Endo What are great, but there's kind of this expectation a lot of us have that it's just a little surgery and then we're going to be 100% better. And it leads for kind of dashed hopes for some of us. So I like to say we should really train for it and recover from it as we would consider other big physical challenges like labor, which if you delivered a baby is an enormous Herculean task to prepare for and recover from. And even something like a marathon where you're really building up your body to be as strong as possible so that you don't kind of crumble in the middle of it.
Yeah, totally. I think I agree that I think that a lot of people, I feel like now the conversation is better, but initially it was like surgery is going to fix you. Like you're going to go into surgery and you're going to have surgery and you're going to be 100% better. And that's not true. We know that there needs to be a lot of preventative stuff that's worked on, and post-op, you also need a lot of support. You need that healthcare team around you as well to make sure you're feeling your best. Okay, a little disclaimer. Obviously, this information is not medical advice. It's not intended to replace seeing licensed health professionals. This is obviously not tailored to your specific body or situation. So make sure you please consult your doctor. And even with all the supplement recommendations, make sure you do bring this, to your doctor. With some of the supplements, your doctor may want you to stop them 2 weeks before surgery. So, before taking anything, just talk with your doctor. All right, so pre-op nutrition. So the key strategy here is to eat as anti-inflammatory as possible before and after surgery. So this is Katie's expertise, so I'm going to let her take this away.
Yeah, this is the topic of my 400-page book, so we don't have that long to talk about it. So I just tried to give a basic synopsis that, your body is made up of nutrients, not calories. And that's something a lot of us don't quite understand when we're thinking about diet or dietary shifts. And when we have a disease that is an inflammatory disease rooted in immune dysfunction, we need to absolutely increase the amount of nutrients to kind of build up our stores to fight this battle. So I created this little picture. I think it brings home that, the amount of inflammation a normal person may have It's a totally normal process, right? So you have a little bit of inflammation, but the bottom picture with the dragon destroying the whole town, that could be the level of inflammation someone with endometriosis might be experiencing. And it's why research shows we might need up to 54 times more antioxidants than someone without inflammation. So that's pre-surgery, right? And if you're having surgery, you're definitely symptomatic. There's a reason you're getting the surgery. So we can assume that your inflammation levels are high. And when you add in a surgery, that is an enormous amount of pressure on your body, because it's not just, they're not just opening you up, they're taking out tissue for some of us, an enormous amount of change internally. So we really want to have the strongest body possible. And the way to do that, it's not rocket science, okay? You can really focus on a few things. And this is where I just have this basic list of focusing on vegetables, fruits, cold water fatty fish, organ meats, quality proteins, seaweed, and ancestral fats. And the thing about this list that is hopefully exciting is few people actually could check off all of these as eating them consistently. So sometimes when we shift our perspective to, oh, we just need to eliminate all these foods because that's going to stop my pain, to I actually need to switch the types of food I'm eating and really start to balance my internal cellular health that way. That you can see we can make a lot of progress by doing something like increasing cold water fatty fish, 3 to 5 times a week, organ meats 2 times a week. Just having quality proteins and some seaweed, for the extra nutrients is really helpful. So this is a basic list of foods that you should consider prioritizing before surgery. I just made this simple, a little more simple, of which nutrients to focus on. So I would say for women who you're not dealing with significant stomach issues, so maybe like half of us would do really well with this recommendation that plants should make up the bulk of your plate. This is what I consider plant-based. It's that there's a lot of plants, and from the plants we get a hefty amount of antioxidants, especially in the form of something called phytonutrients, which are really, really cool antioxidants. They're actually what give plants their pigment. So when you see a purple plant or a white plant, it's phytonutrients that do that. And that's why you're recommended to eat the rainbow. Like, it looks pretty, yes, but also because it gives you so many antioxidants, and numerous phytonutrients have been studied in relationship to endometriosis with really positive results. So since there's thousands that haven't been studied, the greatest thing to do is just to load up your plate on veggies as much as can. And then from animals, they make up a smaller percentage of your plate. And I like to say, I think quality and nutrient density over quantity. So I list here nutrients that you want for your body that are specifically researched in relationship to endometriosis, that most of us have significant deficiencies in these nutrients, and they're the nutrients that we need to heal. So iron, vitamin D, zinc, EPA and DHA, and vitamin A. You'll get all of this on the recording after, so you don't have to write anything down. But, this goes to show, how organ meats, really iron, zinc, vitamin A, great. Cold water fatty fish and shellfish are great for iron and omega-3s, and vitamin D. So you can kind of get a lot of bang for your buck if you just incorporate a few of these foods more often.
Katie, if people don't like eating liver, what do you like to recommend?
Who really likes eating liver, except my mom? So there's many ways to do it, to eat liver. The way that I really recommend now is the easiest is to actually just grind up a little bit of it and blend it into your ground meat mix. So say you have like a pound of ground meat, you could just take like a small amount at first, like 3 tablespoons, and mix that in. And it has a little bit of flavor, but you don't taste it and you get used to it. So, if you eventually have like a 1/4 cup of liver in a pound of meat or something, that might be as far as you get. But if you eat that meat throughout the week or, throughout the month, then you can you'll be eating something like a pound of liver a month or something like that. Now, if you're super adverse to it, like it's the most disgusting thing in the world to you, there's liver pills, dehydrated liver pills. My only issue with the liver pills, because otherwise I think it'd be great, is that they're really, really expensive.
Yeah.
I live on Kauai, and you can get like an entire liver from our like local butcher guys for $20. And one bottle of this, like the liver pills, I think they're like $60 for like really good quality grass-fed liver supplement. So if that's not an issue, feel free to you can just swallow them. But if you're ready to kind of have a little more affordability and get used to the flavors, you can also cut them really small and freeze them and then swallow. But I don't know, I've tried that before and it's so labor intensive.
Yeah, I feel like I've tried all the different ways to consume liver, and I think I ended up with like the Pro Mix liver capsules. Those are around $40.
Okay, yeah.
Yeah, you get a month's supply, but then I tried doing the way of cutting it and adding it to my ground beef. That is definitely a good way, and I like that more because then I'm getting like the real thing. You know what I mean?
Hmm.
So
That's how I get my kids to eat it. Yeah.
it's a good idea.
Yes, this is just an image of what does this look like. Like I said, it's not rocket science. We don't have to overthink it. I think, we're so pressured to do these enormous dietary shifts, and you can really just think of more plants, make sure there's quality protein there, the eating the rainbow thing. You can eat keto this way, you can eat standard American, do these swaps, paleo, vegetarian. It's just making sure you're eating much less processed foods, if any at all, and much more just whole foods centered around the exact nutrients that I was just talking about. So for the other half of us, and I'm just guessing it's about half, is that we have really sensitive stomachs. And you could look at those plates and be like, I am never going to eat that, like now or before a surgery. So many of us have IBS, and a lot of that IBS is actually rooted in something called SIBO, small intestinal bacterial overgrowth. Some of it may not be, but we also know with endometriosis, there can be so much inflammation in the peritoneal cavity, there becomes an issue with peristalsis, which is how your intestinal tract like shimmies food forward. And if it has trouble with the peristalsis, it actually can sort of stagnate and create these pockets of bacteria, which leads to SIBO as well. So some of us will feel a lot better after the surgery, or we'll actually be able to tackle the SIBO better after surgery. But in the meantime, really, I would consider a low FODMAP diet for short term. It should never be a long-term thing, but if you have a few months before your surgery, I'd give it a try to see if it makes a big difference for you. And then you can also play around with which ones you can tolerate and which ones you can't, because a lot of us could maybe like tolerate a few different varieties, not others. And I'll talk, if you see the bottom part right there, the picture, it's what it stands for. They're basically fermentable carbohydrates. They're sugars, oligosaccharides, disaccharides, monosaccharides, and polyols. And over to the right-hand side are examples of what those include. So if you're interested in the low FODMAP diet and you've never heard of it before, you can Google it and you find an extensive list. Do not let that list overwhelm you, because you'll see things like an eighth of an avocado is allowed, or you can't eat, like 50 different foods. But I would guarantee you don't usually eat those 50 different foods. I think if you print out what's allowed on a low FODMAP diet and what's not, you can circle the ones that you eat a lot of. Like maybe you eat a lot of apples, and now you're going to decide to eat papaya instead. So that's a lot easier way to do it without overthinking it. And the other thing is just to eat small meals. You don't have to have a huge meal. That can really help, especially if you're dealing with constipation. And it's something that we'll talk about time and time again, is you want to eliminate constipation as much as possible before surgery and after surgery. It's something that can create, a lot of pain and pressure, onto the lesions, onto everything. It's like the last thing you want to do after you have a surgery is have a really challenging bowel movement. So trying to get that under control as much as possible beforehand. So even if it means a little bit of a limited variety short term, I think that's totally okay in order just to soothe the digestive system.
Do you want me to do this one?
Yeah, you can do that one.
So some pre-op, who should do this one? Gal, are you here? Gal, are you here?
I am here.
Okay, Gal, you do this one. Gal's my student. She was just working with me for 10 weeks, and she helped me create a little pamphlet for our endo patients. And she did this slide on our pamphlet. So Gal, you go for it.
Alrighty, so what we kind of taught our patient was also, like you said, eat smaller meals and a lot of meal prepping. We recommended too, just to have nutrient-rich foods, like Sabrina said, like a lot of soups, stews, smoothies, and a lot of protein in each meal. And yeah, we did recommend bone broth, collagen powder, and to keep the blood sugar balanced by adding fiber, protein, and a lot of complex carbs and healthy fats.
Thanks, Gal. Yeah, so some high quality protein shakes that I like. I use ProMix personally. I know that's whey though, and some people don't react well to whey. Or Organic has a great vegan protein powder. Truvani, Just Ingredients. Those are good brands. Katie, feel free to list some off if you also have some that you like too. And yeah, Katie, like you let me know what you think, but we really encourage patients to do some meal prepping before and after surgery, ideally before surgery, or look into a meal prep service that can just save you so much time. You know, you want to keep things light. You don't want to be standing all day long cooking. Easy to digest meals and high protein. And Katie actually wrote there that those with endo may need 2 times the protein. So Katie, if you want to comment on that, I'd love to hear what your thoughts are.
Yeah, so it has to do with inflammation, that when you think of a bodybuilder needs extra protein to build up muscle after they damage the muscle tissue, you know, you need extra protein. Well, it's the same thing with anyone with chronic inflammation, but instead of building muscle, you're just repairing the damage from the inflammation. So scar tissue is simply the result of damage from inflammation, right? There's all sorts of damage from inflammation. And when you have that much damage throughout the body or in specific areas, like where your endo lesions are, that you want to heal that as much as you can. So if you are deficient in protein, that's when your body can do stuff like start to mine it from your tissues. And you see a lot of muscle wasting with the endometriosis body, the body mining things like the joints for, you know, the collagen and the repair that it needs. So that's why you can have knee pain and ankle pain and stiff shoulders and feel really weak. It can be part of the issue that you're not having enough protein. So it just becomes extra important.
Yeah. Pretty.
Yeah, I just do these as like other examples of, you know, there's the example of what a good plate is, but if you're, you know, really prepping for surgery, the days beforehand, when you want your bowels to be moving, not, you know, getting stuck in any area, that you can have a very healthy diet normally, maybe one that, you know, has a lot of raw food and nuts and seeds. But before a surgery, and even after, really think things like slow cooked, nutrient dense, and easy to digest. So soups, stews, roasts, mashes, and purees is what I wrote, and smoothies. Things that take so much pressure off of your digestive organs on breaking those foods down. A lot of us have digestive insufficiency to begin with. So it can be really helpful, a nice nourishing way to get your nutrients.
Yeah, that's super helpful. I think not a lot of people know that, or they're not told that by their surgeon, like these easy to digest meals. So this is a really great visual. Okay, so just some ways to keep blood sugar balanced around meals. You can actually dilute, ACV stands for apple cider vinegar. So you can dilute some of that in water, or you can there's a supplement out there called glucose bitters. It's by Organic Olivia. It's a little herbal tincture, and you can put that in your water as well and drink that 10 to 15 minutes before meals. This can help reduce blood sugar spikes, but do skip this one if you have interstitial cystitis or painful bladder syndrome. The order of which you eat can also help reduce blood sugar spikes, such as eating veggies first, then protein, then carbohydrates like starches and sugars last. Walking 10 to 15 minutes after meals, having a fat and protein rich breakfast, and again, eating sugary foods at the end of the meal and not alone or first. Anything to add here, Katie?
No, that's a great overview.
Okay. So as far as like pre-op hydration goes, honestly, even if your surgery is like months away, or if you don't even have a surgery scheduled, we should be drinking filtered water with minerals. I like to do this by either getting trace minerals, and I'm going to send everyone this PDF of the PowerPoints because everything you see underlined in the presentation are all links. So you just click on it and it goes right to what the recommendation is. So trace minerals I add to my water, electrolytes I add to, especially on days that I'm sweating more or just need a little bit more support, or if it's hotter that day. And you can also do something as simple as getting Redmond salt or Celtic sea salt, and you can just do a sprinkle in your water. That is a great way to add minerals back into your water. And obviously hydration is super important to reduce constipation. And Katie actually wrote to drink 10 to 12 cups of water per day in between meals if you suffer from constipation. So Katie, if you have anything to add here.
Yeah, I wanted to put a picture. Have you heard of a redundant colon before? No, you can Google it. It's basically like longer than normal colon, and it's pretty rare in the general population. They say like around 3%. But if you have bowel endometriosis, it's 40% of women with bowel endometriosis appear to have this redundant colon. So you say almost half of us. So if you have this really long colon, you might suffer from constipation and think that it's, you know, fiber or maybe SIBO, but it could actually be this actual issue of a very, very long large intestine. In which case, you just need to drink so much more water, because what the large intestine does is it absorbs water. So if you have, you're drinking technically adequate water, but then your stool is drying out halfway through your intestinal tract or almost to the end, but not quite making it, the second the stool is too dry, it starts to do that compaction. And this is where you may have, diarrhea from taking too much magnesium at first, and then have okay bowel movements, and you go for 2 days again without having a bowel movement. It could be related to this. So if you do have issues with constipation, look up redundant colon. It's really interesting. And it might be associated with some bowel endometriosis symptoms. So just drink more water. A lot of us aren't drinking really enough water, especially if you're drinking caffeine or stressing or eating, sugar, blood sugar imbalances. And it's kind of crazy how much it can help. So it's also free. So it's a free, maybe very helpful thing to try.
I'm gonna show a picture. So I don't know if people can see this. It like low-key looks like a penis, so I'm so sorry, but it's not. It's a colon. It's a colon.
But
So
that's just one of them. They can look all different too. Like any part of the colon can be too long.
oh wow, that's crazy. Okay, well, this is an example. This has a redundant sigmoid colon, so you can see this one's the one that's too long. You can see how much longer it is compared to the other one. Are you able to see that? Yeah, that's pretty crazy. Wow, I didn't know.
Yeah.
That. So you're saying people with
Almost
bowel endo are more likely to have a redundant colon?
Yeah, that's what was showing. 40% have a redundant colon, when 3% of the normal population would have a redundant colon. So it's like really, really associated with a lot of us with that bowel endometriosis.
Wow. Okay, so some pre-op supplements for adhesion formation. So wobenzyme is actually a type of proteolytic enzyme. And this actually has been shown in studies to help reduce inflammation post-surgery and aid in clearing waste products from the wound site and helping reduce adhesion formation after surgery. So that's really cool. Another adhesion supplement is fish oil. This is very, very well known and common, but this can be taken daily to help minimize adhesion formation. And I put the dosages there as well. But these are the two supplements that I see a lot in the research to help prevent adhesion formation post-op. And they recommend taking it around 60 days before surgery and 60 days post-surgery. But you may have to stop taking this 2 weeks before surgery. That's why I was saying bring this, if you start one of these supplements, let your doctor know, because they may want you to stop it right before surgery, because sometimes fish oil can have like a blood thinning effect. And again, with the whole presentation, everything that's underlined, you're going to get links to. So I do have some links in the top left corner to order, all the supplements that we recommend here, or that I recommend here, and then some individual supplements. Katie, did you take any supplements before your surgery to kind of reduce adhesion formation?
No, I didn't. I didn't know anything about any of this back when I was having my surgeries.
Oh, okay. Okay. Gotcha. So then some supplements for bloating and gas. A lot of my patients really, really love ginger and peppermint. So interestingly, in the research too, ginger powder is usually more effective than fresh ginger root and then just ginger tea, like the tea bags you can buy, because it's so concentrated. So ginger powder can be really helpful for constipation, bloating, and gas. The dosage is there. That's from the research, the articles that I found. And then turmeric or curcumin can also reduce pain and inflammation at that dosage for that amount of time. And then peppermint, usually I recommend this just in the form of a tea. Capsules can also be great too. So those are 3 different supplements that people respond really, really well to before and after surgery, but specifically after surgery. I know this is pre-op, but really post-surgery. Anything on this, Katie?
I would just say if you have stomach upset and like in your stomach organ, not just digestive, these can be a little hard on the stomach, like ginger powder. If you take peppermint capsules, and even curcumin and turmeric can be almost can create like a burning sensation or heartburn. If you have gastritis, a lot of us are dealing with those types of issues. I would never take any of these on empty stomach. If you're like that, take them with food and start at a lower dose, just in case something like, the ginger powder, burns your stomach for a few days. I would just start with a really low dose and keep testing and, going up, working with your body where it's at.
Yeah, it's good. And then some for supplements for constipation. Colace is usually recommended by every surgeon. I don't think I've ever had a patient come into the clinic and say that their surgeon didn't recommend colace. So I'm a big fan of colace. I know it's not the cleanest out there, but again, the biggest thing is that you're not constipated. So, if we're using colace before and after, so be it. You can also use magnesium citrate or oxide on top of that. I would say stick with the colace. And if you need a little extra support, opt for magnesium citrate. Oxide can have a bit more of a laxative effect. So really, I only recommend oxide for more like emergent situations if you feel really, really backed up. Do start slowly again, specific with magnesium citrate and oxide. Start around like 400 milligrams, then build your way up, but you can go up to 2000 milligrams safely. I don't think I've really ever recommended that to anyone. Like they've never.
I was going to ask if you've ever done that.
No, they've never, no one I know has ever needed up to 2000. I would say max usually is around like 800 or maybe 1000. But I would say start around 400. Any thoughts on this as well?
No, that sounds good.
Okay, cool. Okay, some movement talk. How are we doing with time? 5:30. Okay, cool. So pre-op movement, you can be exercising the way you normally exercise, but we do want to start adding a little bit more of like stretching. I really love the YouTube flow at the bottom that I linked here. It's a flow specifically made for like abdominal adhesion. So it's a flow for like post-op, like 6 weeks post-op, but I would say do it pre-op so that you get like kind of in the groove for more abdominal stretching, myofascial release, all of that kind of stuff, so that it's not super, super new to you post-op when you may be a little bit more uncomfortable. Pre-op wise, we also love to go over transitioning. So meaning like when you're getting in and out of a car, getting in and out of bed, up and down from a chair, because that can really reduce pain and reduce discomfort around those incision sites. And there's a video on one of the next slides, so I'm going to show it to you. Practicing core and pelvic floor coordination. So how to properly engage your deep core is super important, because you're going to need to do that when you're doing these transitional movements. If you're having a bout of intra-abdominal pressure, like coughing or sneezing or laughing, like you want to protect that core by actively, lightly engaging that deep core. And then practicing some intentional diaphragmatic breathing exercises, which we'll go over that as well. I know Katie put a couple slides in around core too, so I'm excited to hear her thoughts on that. Let's see. Oh, here it is.
Oh, I put these in just based on what you said as visuals. I'm such a visual learner.
Yeah, I love it. No, I love it. I love it.
When we talk about activation of the deep core, it like doesn't make any sense to a lot of us who, we think of like a plank, like, oh, that's activating it. But you can do all these things for core work without activating the core correctly. And what that does is it puts pressure on, I say, your nether regions, right? Your reproductive organs on your pelvic floor. And that will be the next image. I have a picture of that. But this is just an example. If you lie on the floor and lift your legs off the ground, sort of like a tabletop, and this is like, a core exercise you would be recommended by many. If you see this loaf of bread, so to speak, in the tummy, where it looks like the middle of your tummy is coming right out of your body. So those are your organs pushing out and down. And that is putting so much pressure on your linea alba, on your pelvic floor. And you're not engaging your core correctly, so that when you go to pick up your niece or nephew or like get out of the car, if you're not activating your core during practice, you're probably not going to be doing it when needed to, and that can cause a lot of trouble.
Absolutely. Yeah, that's a big thing that we hone in on pre-op, because, basically I tell people you want to avoid going like, like you want to avoid doing that on the toilet. You want to avoid doing that when you're getting out of a chair. Like try to avoid holding your breath while you're moving. Always exhale and engage with exertion. That's a really great way to engage that deep core. But there are a couple more cues that we'll go over in future slides. Yeah, so this is a great visual. So you go for it. I really love this visual. This is in your book, right?
Yeah, this is from the book. This just shows what happens when you loaf, proverbially loaf. On the left-hand side, it shows exactly what Dr. Sabrina is talking about. You're activating your core and you see the arrows pointing up. It's like your pelvic floor at the bottom is really supported. Your ribs are opening wide. And, I also say visually, this is the core set everyone is after, like this natural core set of a core strength. But on the right-hand side, you see if your ribs don't expand and you're not engaging your core, all of the pressure goes down. So here the image of someone, you know, with loafing because the organs are pushing forward and down, and that leads to actually damaging the tissues of the lower tummy so much. That's why so many of us have like the lower belly pooch, so to speak, that doesn't go away with core exercises that we're used to, because we're actually not engaging the core to cinch it together. And, you know, maybe more importantly, it's all that pelvic floor damage, and you have, you know, all of your organs are 11 pounds sitting on your uterus, and you're squishing your uterus down every day with all those organs. That creates a crazy amount of inflammation. Now you have a tipped or retroverted uterus. You have pelvic floor dysfunction that can, you know, cause pain with sex and all this stuff just from having poor core activation. So it's why it's so important. It can really change your life. It changed my life, actually, healing core engagement. I had no idea.
Yeah, I do think that there's a big misconception that people with endometriosis should just be doing like down training, aka like stretching the pelvic floor, relaxation exercises, but that's really not the case. In times of like flare-ups, or you know, you're feeling like tight, for sure, like pre-op, going into surgery, for sure, we want to be more towards like the relaxed state of being. But it's so important, and I know like I do this all the time with endo patients, is we're doing a lot of stabilization training. Like I'm teaching people how to engage their core, how to engage their pelvic floor. We're doing exercises like bridges, bird dogs, like a lot of these stabilization exercises, because even though someone's a bit more on the inflamed side, or they're feeling, you know, even if they're feeling pelvic floor tightness, like we still have to make sure that you have a stable body, that your joints are protected and your muscles are firing the right way. So it really is about finding that balance between like stretching and strengthening. Like the balance is stability, and that's what we try to find in therapy a lot. Okay, so I kind of mentioned preparing for transitional movement. So 3 big things here is using the core properly, like Katie was just talking about, using your breath, and also having a pillow on hand for day 1, day 2 post-op can be super, super handy. And I'm going to tell you why right here. So I don't think this video is going to play.
So this is how and
like,
why
I don't
we
think you
want to
can
use
hear
an
that.
abdominal split.
Can you hear that? Did you hear
I
that?
can hear it.
You did?
I think so.
Grab a pillow. You can use this pillow. It can be from your bed, the throw pillow, any kind of pillow you have on hand. Bring it to your surgery. Okay, bring this to your surgery and have this handy 1 to 2 days post-op. So the purpose of an abdominal splint is to splint it, press it into your abdomen with a bout of increased abdominal pressure. So what would increase abdominal pressure? Coughing, laughing, sneezing, transitioning. So you have a cough coming on, press that pillow into your abdomen. That will help protect those scars. You have a sneeze coming on, same thing. You want to get up from the car or from your bed or from a chair, and you're day 1, day 2 post-op, still feeling kind of sore in those incision sites. Press that pillow into your abdomen and stand on up. Okay, so that's how we're going to use the pillow to kind of provide an external method of support to our.
Okay, so you can use a pillow as an abdominal splint. There's also some people like to use an abdominal binder, and this is not a waist trainer, not a waist trainer. It's like a very loose, it's like secure but loose enough, right? It's not like squeezing you in. It's just to kind of provide some external support. So I did link that below as well. Again, you're going to get that in the PDF, but I give this to a lot to C-section, like post C-section scars, that can be really, really helpful and feel like a little bit more secure. But that can be really, really helpful day 1, day 2, even day 3 post-op, if you're kind of feeling like around those incision sites, or it's feeling kind of uncomfortable or sore.
Okay, so now I'm going to show you how to get
this one's like 2 minutes, so I'm not going to play this whole one. But basically in this video, which you're going to get the link to, it's me showing you transitions of getting in and out of bed, showing the log rolling technique, getting in and out of a chair, getting in and out of a car. And basically the takeaway here is, again, using that core, using that breath. So for example, a great way to kind of cue using that deep core is like drawing that belly button into your spine. Sometimes people will kind of suck in when I give that cue, but it's kind of hard to know, who responds well to that cue without like visually seeing them. But some people respond really, really well to drawing that belly button into their spine. Some people respond well to imagine like you're fogging up a mirror. So like all the way to the end of that exhale, you should feel your transverse abdominis, that's that corset muscle, really turn on. Or another good cue is like making the F sound. So and doing that to the end of your exhale, feeling that transverse abdominis muscle, that deep core turn on. So using that deep core with your exhale during the hard part of movement. So you're getting out of a chair, getting up is usually the hardest part. So you're sitting. Okay, I'm inhaling, exhaling, engaging. And then I stand up. And that's a great way to protect the core and protect those incision sites. Take it away, Katie.
Oh, yeah, I just added this in last minute that maybe the most important thing for a lot of us is just having a really positive mental state over the surgery. I have gotten, so many messages from women saying, I'm going to get surgery soon, and, A, B, C, and D about all the disasters that they're worried about. And is the endo going to come back? And I can just see their brain like melting out of their ears with stress. And a lot of it is like, they don't know how bad it's going to be in there, right? You don't know if you're going to come out with a stage 4 endo diagnosis. They're terrified they're going to need a hysterectomy. They don't know if the doctor's going to make a mistake, like on a bowel endometriosis thing, and they end up with damage or something that needs, further surgeries. They're real concerns, but they're also concerns that are out of your hands. Like I would say, a lot of us worry about things that we can't control. And unless your doctor is known like to mess up surgeries a lot, I would just say cancel the surgery and make a different, find a different doctor. But most of us have really thought about this. We're working with the right doctors. And it's kind of just giving it over to trust at this point. And I love to support visualizations of just, you have to stop that voice in your head that like talks in your voice, which is very irritating because you think it's you, but it's not. You have to say stop. And then imagine it just, everything is going smoothly and you are so perfect and everything is so healthy. And you come out really, really healthy because no matter what happens in the surgery, you can't control it. The thing you control are your stress hormones, and those directly impact how much inflammation you have in your body. So if you want to increase inflammation systemically before your surgery, keep thinking about all the bad stuff that's going to happen. If you want to work on detoxification and the mending and healing and repair parts that we really, really need, focus on how successful it's going to be and how excited you are. I just say when I watch my son play soccer, it's like he's 5 and you just kind of want to like do anything to kick the ball. These little 5-year-olds don't know what they're doing. You just have to get hands off. And so that's just my recommendation. Just even though it's a surgery, just go with trust and, it's a journey.
Yeah, no, I love that. That's great. That's like great advice. And I would only add to it too, like make sure you get a good night's sleep. You want to be well rested going into surgery, right, Katie?
Oh, totally. Yeah. I mean, poor sleep will just wreck you. It's like the number one thing, just wreck you with one night. I mean, you usually have to get up early for these surgeries anyways, but yeah, the more calm you are and relaxed, the better you'll sleep too.
Throw on some 528 hertz music. Okay, now let's get into a little bit post-op. Like Katie said, go into this confident, go in calm, you chose the surgeon. Hopefully they have amazing stellar reviews. They're an excision specialist and you're in great hands.
Yeah, I think I call this meducation because I don't want to shame anyone for taking medication ever for like a chronic pain condition, especially, your body best. But I really, really, really want to say that opioids should be taken with absolute caution, and you will almost definitely be prescribed opioids. If there's Oxy or Vicodin or Tramadol or something. First they're addicting. I think it's something like 1 in 3 people who try opioids get addicted. It's some insane amount. But beyond that, this is what I dealt with is one, they're very constipating. And this if you watch TV, there's actually advertisements to reverse, opioid constipation. It's that common. It's like if you take opioids, you'll be constipated. So obviously not great for abdominal pelvic surgery. Second, they're immunosuppressant. And this really messed me up post-surgery on my first surgery because I was taking Tramadol or maybe Oxy. And I got sinus infection after sinus infection. I've never been so sick before. And it was after that, I was doing my research and I realized that these drugs are definite immunosuppressants. That means you have a much higher likelihood of getting an infection, not healing fast enough. You might take a lot longer to actually heal from pretty extensive surgery than if you don't take the opioid. Now, here's the thing is that a lot of us are thinking surgery involves a lot of knives and scalpels, sort of like medieval stage, right? And it's like, your surgery, you should come out of surgery not in excruciating pain, which is actually what opioids are good for. They're good for like stopping this excruciating pain. you shouldn't have excruciating pain. If you're in a lot of pain and you need an opioid for a day or two to help, like that I would consider normal, and maybe that's the best thing for you. But if you have pain where you need an opioid and something like an NSAID is not addressing it, call your surgeon. Like, it's definitely not okay to be in such excruciating pain that you need to take oxys or whatever one that you've been prescribed. If you can just stay on NSAIDs, no painkiller is great for the body, but something like ibuprofen, up to 800 milligrams, it can really, really knock out pain for most of us. And that should be a decent alternative.
Yeah, I'm glad you added this slide because that's definitely something super important to talk about. One thing, you know what, it's 8:45. Let me see. Okay, actually perfect. Let me do this slide and then we'll cut to Q&A because I know you have to go. Does that sound good?
Yeah.
Okay, cool. So one thing that a lot of people report that they're like, what the heck? Why do I have shoulder pain? Is shoulder pain. And the reason for this is because in surgery, and I just saw surgery 2 Fridays ago and it was really cool. What they do is they are actually inflating the abdomen so that they're able to see everything when they're in there laparoscopically. So when they're inflating the abdomen, this can actually irritate the phrenic nerve, and the phrenic nerve can radiate pain to the shoulder. So a lot of people will end up having some shoulder pain post-op, and they're like, what the heck did they do to my shoulder in surgery? It's strictly from inflating the abdomen to be able to see, what they're looking for in there. So one way we can kind of combat this is early heat pad application post-op, early mobilization, and I did add some shoulder mobilization exercises in the following slide, but that can be a great way to kind of reduce some of that shoulder pain. And honestly, I would even say doing some of these shoulder mobilization exercise pre-op just to keep that shoulder joint mobile, stay nice and stretched out going into surgery. That will give you, hopefully better results post-surgery. Post-op pain relief, again, we've mentioned this multiple times, that we really want to avoid constipation, like really bad, because if you're constipated, right, this will make your abdomen feel a lot tighter, blown up, bloated, and this can increase pain on those incision sites. And a good way to mitigate pain relief too is to increase some walking or light walks and increasing the length of walks each day. Going to talk about that in another slide coming up. But we'll take a little break here just so we can ask Katie some questions, and then we'll finish up. I think there's like 2-3 slides left on exercises, and I'll just have Gal hop on and we'll finish that up together. But yeah, does anyone have any questions for Katie before she heads out? No way. Like, I know someone's got to have a question.
I have a question.
Okay, go
With
for it.
regards to post-op, and starting to do some exercises or light walking, like what's kind of a good timeline for starting to do those, or kind of what to expect post-op? Like, is this something that you're supposed to wait a couple days, a week? Like, what kind of did you notice from your surgery?
So I will just say before Katie answers, the next 2 slides is like a timeline for exercise. But Katie, go ahead and share like your experience if you want to share your experience.
My experience was awful. You can't follow my experience. I thought, like I said, I was going to be playing tennis right after. So I was like just running on fumes trying to get back to normal. And my recovery was awful. So the next few slides they're so important just to relax. It's kind of like the difference between my first baby and my second. I learned so much about how weak the pelvic floor is after having a baby. And the second one, I was like, I followed all the instructions. I didn't get out of bed very much the first, 3 days, and I just walked a little bit. So just being really, really gentle on your body and not doing anything that pushes it to any degree, I'd say. Too soon.
Yeah, we'll go
Thank you.
through a specific timeline, Annalise, before, like right after Katie hops off. Anyone else have any questions for Katie?
I have a question.
Yeah.
Hi, Katie, big fan. I was curious if you have any tips on how to find those surgeon reviews. I mean, I know Nancy Snook, but are there any other ways, or what's the number one way you think is like a great way to vet your providers?
Well, I can say what I know, and then if you have different ones over there, Sabrina. But yeah, Nancy Snook is okay. I never pretty much send people there anymore because there's been so many people that have had poor surgical experiences with, these surgeons that aren't really vetted. There's no one vetting them. So there's a site called icarebetter.com, and I don't know why it's called that, but it's just I Care Better. And they actually vet surgeons. So the surgeons have to send them in videos of them doing multiple different types of surgeries. And then you can find people kind of all over the world, as far as I was just looking even in Central and South America, and they're listed there. The only issue with that one is it's not free, so it does limit. It's not like just anyone can do it. Their surgeons are paying like thousands and thousands of dollars to be on the site, so it can be marketing, but it does give us the idea that they have been vetted by other surgeons, which is good.
That's great.
Do you
That's
have anyone?
resource? So usually, I mean, I will usually do word of mouth. Like I feel like I have a pretty good idea of different surgeons, at least in the US, just from like, you know, my network, but I usually will refer people to Nancy's Nook, but I will always tell someone to make sure that the surgeon has a MIGS fellowship, so minimally invasive gynecological surgery, because it's honestly appalling about how many gynos have endometriosis surgeon on their website and they're not an endo excision specialist. So they really need to have a MIGS fellowship, and they have to have a fellowship underneath an endo excision surgeon. They need to have both of those things. So it's a very specific training that a lot of gynos don't have, yet are still marketing towards endometriosis.
Yeah, I see that actually more and more. It's really important that there are so many gynecologists marketing endometriosis surgical expert, and they are a 100% not. So,
Yeah.
and, you know, it's so annoying, but you do have to do due diligence.
Yeah, it's very, because those are probably the surgeons that are doing ablations. So
Yeah, and missing a lot of the endo.
yeah, yep.
I have a question. Hi there. So I actually had my procedure 11 days ago, and they found stage 3 endo, mostly in like my pelvis and my ovaries. Is it I guess I have a few questions. Is it normal for them not to send the tissue or any of like the growths to pathology to get those tested if they feel like it's not necessary? Have you ever heard of that?
So the surgeon that I always refer to in Miami always gets everything tested.
Mm-hmm.
I've heard that
Yeah,
as well,
I
that they should send everything. And one of the things of looking for a good surgeon is actually to ask how many pathology reports that they submit, because if they're just doing 1 or 2, they're not doing it correctly. I've heard that from Dr. Iris or Bush said that.
Okay.
Yeah,
And
obviously not trying to like scare you that your surgeon did something wrong. Like
yeah, no.
maybe they really just took out some tissue and they're like, this, we know for sure this is an endo. But at least in my experience, like with the surgeon that I refer to a lot, she actually sends up to the patient like all the tissues that she sent to pathology and then what the result was. And sometimes the result is not endo, not endo, you know? So I know that gives the patient some peace of mind too. So maybe you could bring that up to your surgeon.
Yeah. I thought it was interesting that she had said she didn't. I mean, I'm learning a lot of things about this whole process, and but on 2 other quick questions. Is it normal to be like extremely bloated and like still recovering after 11 days of the procedure?
I mean, we can each talk. I would say, I don't think we could say it's normal or not. I think it wouldn't be abnormal if that was still happening. When you think of, especially if you had stage 3 and there is a lot of tissue that she removed, like if you imagine when you twist an ankle and you can have a swelling inside, you know, that ankle joint for quite a while, even like a bee sting, my bee sting will like swell for days and days. So it's pretty much a major surgery. So I would say it's not abnormal, but definitely keep an eye on it. Remember, like the bloating and constipation thing, that even if you are having some bowel movements, if they're not large in nature, you can be going but still be constipated without realizing it. So something, if that you relate to that, dealing with something, trying magnesium or and then also if you're it's more bloated than usual, like you were never this bloated beforehand with the endo.
No,
Yeah.
I wasn't. And I follow a lot of, I mean, everything that you so far have covered regarding nutrition and just the healing process. I've been doing, that's just like my life normally. But yeah, it's pretty bad. So a lot to learn here, obviously. But it doesn't feel like it's normal or feels right.
Is there pain or any, I mean, if it's TMI, any discharge or anything that's like really out of the normal still? Or
No, not TMI at all. I'm very open. And I've been having normal bowel movements. Thank God. I didn't even know that was a possibility after the procedure. She really she wasn't very thorough. But and a great gynecologist, but I think maybe now I'm learning she doesn't specialize in endo. And I needed to be a little bit more mindful of that going into this procedure and process. But more pain for sure on my left incision, and still like experiencing that, and like just mobility and things like that. And they just keep telling me like just their recommendations, and I'm heating pad, like putting pressure when you sit up and sit down. So I'm learning a lot about all of this again, and I feel like I might need to reach out on a separate, call or set something up. But it just seems like something isn't fully right in my body.
Well, first of all, don't beat yourself up for feeling like you found you found the wrong doctor, because what's done is done. And honestly, maybe
Right,
just because some doctors don't have a train doesn't mean that they're not good, right? It's just like they
of
don't
course.
training. So, and it's not always easy to find MIGS doctors that have had a fellowship under an endo excision specialist. So like, you did the best with what you knew. So we moved
Right.
from here. One thing, and actually my student just texted me this when she's on the call. So Gal, if you want to talk to, you can talk to, but in the surgery, when we see the abdomen inflated, like it's really inflated. Like it looks like they're almost like 6 months pregnant. Like that's how much they inflate the abdomen. So I wouldn't think it's completely abnormal to feel like maybe a little bit extra bloating after the surgery because of how much they inflate it. Like everything was super stretched. So maybe it will just take a little bit more time for things to calm down. Like Katie said, you could still be like really inflamed from the surgery. So I would say, I mean, I know it's been 10, 11 days. That's a long time now. Give it 2 weeks and see how you feel. Make sure you're still you're going to see the post-op yoga flow, maybe do some yoga like that, some of the like light abdominal stretches, and make sure you're walking a lot and see how that goes. But Gal, do you have anything to add, Gal?
I think you covered it all, and like you said, like your abdomen is in that stretched position for hours
Like
at a
we
time.
were like Gal and I, like I had no idea. Like we knew that they inflated the abdomen, but it was pretty crazy to see. And Gal and I literally looked at each other and we're like, wow, we gotta really prepare people for this a little bit more, because we didn't realize that like how much they inflate the abdomen to get in there.
Yeah.
Yeah, and
Yeah. Sorry, go ahead.
I was just saying, like, what we did with our patient to focus on is a lot of like breathing work, working on like rib cage expansion, and it really showed us like, wow, we really need to emphasize this before people go into this procedure.
Yeah, it's something they definitely don't prepare you for. I mean, any of this really. And I'm so appreciative to my friend actually forwarded me this email like 30 minutes before. I didn't even know about it. So I'm so grateful I could be on this webinar. But I definitely have some gut distress, and I don't know if it's from the endo or if I've been getting tested. It's been multiple years now and they haven't found anything abnormal, but I have so much dissension, and normally I have bloating and dissension, and this is like a whole nother level. So I'm just like, is this, is this from the gas that they put in you, and just like the effect of like the inflammation after, the procedure. But that's all really good to know.
I would say just never to discount a gut feeling. Like even if it's you
Yeah.
overworrying and thinking about it, it's kind of like you're the only one that is going to be able to take care of your body, right? Even though you wish the doctors would be like, come on in, we're going to take care of
Right.
you. And calling and saying you absolutely have to go in, you're starting to like really worry about it. And I had this pain on my left ovary when I got pregnant, and then the doctor told me it might be like a twin pregnancy, but like in my fallopian tube, so it could like burst. He's like, we'll just wait and we'll see. And the pain was like, it became more and more intense, and I was so worried about it. So I went to the ER, and they're like, oh no, it's nothing. It's just like a small cyst that's bleeding. And that day the pain went away. because in my head, I had freaked out so much about it. So it's not to say it was all in my head. There was literally a cyst there that was bleeding, the corpus luteus
Yes.
cyst. But just to go, you can go and they can check out and say, oh my God, there is something wrong. I'm so glad you came in. Or you could go in and they'll say, look, we checked you out. You're okay. And that'll help the healing process, right? One way or the other, rather than, because doctors can have negligence and you don't want to be on that side, and you also want your body to heal. So I would just force another appointment.
Okay. Thanks so much. I appreciate it.
That's great advice. Yeah, never ignore your intuition. Let's take one more question for Katie before she goes. Now it's
I have a question. I was just wondering, do you have any other recommendations for if you have a hysterectomy or end up having one, like nutrition wise or other?
Oh, nutrition wise, gosh, I would say I've never done any research on that. If there's specific nutrients for a hysterectomy, I think it's like any surgery, you want to build up your body to have like the most amazing reserves possible. But I don't have any specific information on that. Sorry.
I guess my follow-up question would be hysterectomy and ovaries taken out, or just just uterus?
I'm not sure yet. I know one ovary is going to be taken out. We haven't discussed if both of them are going to be taken out. So
Okay, yeah, because nutrition can definitely, I would assume nutrition and exercise can kind of change if you have a complete hysterectomy, right? You lose your ovaries and you lose your uterus. But if you still have an ovary left, you're still getting that estrogen production. So, you're not really necessarily in a surgically induced menopause. But I would say I wouldn't really think much, Katie, but with ovaries taken out for sure, I would say there'd be some nutrition changes there.
Yeah, you could
Okay,
do,
thank you.
oh, sorry, what was it?
Oh, I just said thank you.
But you were gonna
yeah, I was gonna say if they do end up taking out both ovaries, I would work with someone, because being thrown into menopause so suddenly can be very drastic on the body. And having someone that you can constantly talk to and work through it, a health professional who specializes. There's so many specialties now. You find someone who can specialize that can really help you through the process. So let's hope you get to save your ovary, right? But if that doesn't happen, try to reach out to someone. I would recommend that.
Thank you so much.
Yeah, and Brittany, if you DM me on Instagram, I'll send you some people that I've made, like some resources on complete hysterectomies post endo excision.
Awesome. Thank you. I appreciate it.
All right. So thank you so much, Katie, for being here. Guys, stay on, because Gal and I are going to go through the last 3 slides, and then we'll take some questions about, pelvic floor rehab and movement and all that kind of stuff. So thank you, Katie.
Thanks so much. It's been fun.
You're
all right. Have a great rest of your day. Bye.
Thank you. She's amazing. Definitely get her book. Love her book. Okay, so back to, there's 3 more slides left. Hold on, let me just get, okay, there we go. So week 1 post-op, right? The goal here, week 1, is really getting a feel for what feels good for you. So we want to start establishing those functional movement patterns. That's kind of those transitions like we talked about, really encouraging blood flow, because blood flow brings nutrients and oxygen, and that's very, very important for tissue repair. So starting day 1, we can aim to walk 5 to 10 minutes. And again, these are generalized recommendations. So of course, listen to your body. If you're like, hell no, I'm not walking 10 minutes day 1, then, don't. But these are just some general recommendations. So day 1, aim to walk for 5 to 10 minutes and gradually increase the amount you walk every day up to 20 minutes in the first week. That link is some light mobility exercises for upper body shoulder relief. And I would recommend doing those before surgery as well, just to kind of get that shoulder moving and grooving, so it's not too stiff or painful post-op. And definitely week 1, we really want to emphasize that regular diaphragmatic breathing. Honestly, this should be your norm going into surgery. So really make sure you're practicing diaphragmatic breathing. My favorite way to teach this isn't breathing into the belly, it's breathing into the rib cage. So if you put your hands on your rib cage and you take a nice inhale, imagine your hands expanding, like rib cage is expanding. You should feel that rib cage open up. Your chest will rise a little bit and your belly will rise. So it's really a 3-part here. It's called 360 breathing. And that's very, very important, because we want to distribute air throughout the whole abdominal cavity and all 4 lobes of our lungs. And then weeks 2 to 4. So I know this is kind of like 2 to 4, like what? Yeah. So week 2, that's when we can really start doing some more flows. So we have this beautiful YouTube video, post-op endo yoga flow. It's by Pelvic Health on Instagram. They're great. And then I also added like a bodyweight Pilates flow. And this, I really liked this flow. I watched it this morning, and it adds like bridges and some light bird dog. And again, that comes back to that stabilization training, like using our core correctly and firing up those big muscles like glutes, hamstrings, quads, our back muscles, because you know, we feel better when we feel stable. It's not always about being like loosey-goosey, relaxed. Like we want our body to feel stable and strong. So I really did like that flow a lot. And daily walking. So try to get your walking up to 20, 30 minutes a day. Of course, listen to your body. If that's too much, then don't do that. But I would say like ideally 20 minutes a day would be great. And then you can walk like 5 to 10 minutes after meals to help with digestion. But yeah, the goal here for week 2 is more like flows, stabilization training. Your surgeon will clear you to go back to what your normal of exercise is. And usually they clear around 4 weeks. This may depend on you and the stage of your endo and your surgery, but typically I see around 4 weeks. And surgeons, I went to the Endo Summit in 2023, and surgeons kind of had this general consensus, and they were like, you know what, let's just all make it known that patients should go back to pelvic PT, OT around 2 weeks. So now I'm telling all my patients, come see me at 2 weeks. Not everyone will come at 2 weeks based on availability, you know, their schedules, my schedule, but for the most part, you can get into PT ASAP, which is amazing. And I put weeks 2 to 4 because sometimes people come back like a month after, but if you don't have a PT, make sure you get one, or OT2, I should say OT2. And then the last slide here is self-scar massage. So 2 weeks out, you can actually start doing some desensitization techniques. So going around, not on the incision site, but going around the incision site, you can start doing some like light strokes. So if you're looking at the screen, like let's say my Apple Watch is my incision, you can kind of massage the tissue around. This is desensitization essentially means to desensitize, right? So we want to reduce how sensitive the scar is. So doing things like this can be super helpful. Doing some work, you're going to have bandages on. So doing some like stroking over the bandages, that can also help desensitize that tissue. Now, when the bandages are off, looking into something called silicone scar tape. I recommend this to all my C-section moms. It's like this tape that goes right over the scar, and this can help prevent the skin from thickening and raising. So that's amazing. And then around 6 weeks out, that's when we really start working into that scar. So I added that YouTube yoga flow that's specifically for scar adhesions and abdominal myofascial work. I added a YouTube video on direct scar massage, and I added a YouTube video on how to cup over your scar. And I linked some cupping equipment, and I linked the silicone cups. So they're not the really, really glass suction ones. They're way, way softer, and they're easier to use on yourself. Gal, oh my God, sorry, girl. Anything you have to add with these 3 slides that we just went over?
The only thing I would add, just like we were saying, just really listen to your body and take it as you can, even if it's just doing diaphragmatic breathing while laying down. Even just that movement will help your recovery overall.
Absolutely. Like really any kind of movement is going to be beneficial to your body. Yeah, so that's the webinar. We did it in, you know, less than 1 hour 15, so that's good. Does anyone have any questions on movement timeline, scar massage, or anything about the presentation for me and for Gal?